It
Doesn't say record on my side.
says recording on mine, but
Okay, there we go. Now the recording button is on.
oh no.
So we can start over. We've only been going for like 10 minutes. You want to start over?
Yeah, let's start over. Well, we got to meet each other.
There we go.
Okay, we're recording now?
Yes.
All right, this is Dr. Tressa Pinkleton. How you doing, Tressa?
Doing well, thank you.
We're going to do an interview today with her over the Coimbra protocol. Before we start, I'm going to read a little disclaimer. This interview is from our own personal experiences, and we are not talking in specifics, but generalities, not referring to any individual or particular cases. We're not giving medical advice. Medical protocols and methods of treating should be done with a licensed medical professional. How was that, Tressa?
I think that sounds good.
All right. I should say Dr. Pinkleton. Nice to finally meet you. I've heard a lot of good things about you. I hope they're all true. It's been a lot of
too.
It's been a lot of fun sending people your way and telling people about the protocol. And it's been a lot of fun personally for me getting better, because I was so bad when I started. But the whole protocol, it's just it's the whole reason you go to medical school, is to see people get better. And I've seen a lot of people getting better. So why don't you tell us a little bit about yourself, a little bit about how you found out about the protocol. Okay. And without further ado, Tressa Pinkleton.
Right. So thank you very much. Like you said before, I'm a naturopathic physician, and a naturopathic physician is a little bit different than the conventional medical doctors most people go and see. So I am a licensed physician, primary care physician to most of my patients here in Seattle. And like conventional medical doctors, I received the same type of training when it comes to the science of the human body, physical exam skills, and diagnostic capabilities. Now, where my training and theirs really veer off from one another is that they focus a lot more on pharmaceutical medications and higher intervention specialties like neurology or cardiology or pulmonology, right? I learned quite a bit about those things. I can prescribe most drugs. I do know a little bit of emergency medicine, which is what they also focus on. And I have enough training to know when I need to refer up the chain to specialists for my patients. But on top of that, I have extensive training and knowledge in botanical medicine, nutrition and lifestyle intervention, nutraceuticals, which are essentially vitamins and supplements, exercise and physical medicine, and counseling. And I tend to draw upon those tools before I go reach for my prescription pad. Sometimes I'll reach for my prescription pad right away when it's warranted, because sometimes that type of intervention is warranted right off the bat. But most of the time I try to do some other things to see if we can prevent the need for a pharmaceutical intervention. Yeah.
Now, tell me a little bit about your meeting Dr. Coimbra and doing the protocol and how that came about.
Yeah, so I had a patient who came to me. She had an MS diagnosis, and we were working together with lowering inflammation through diet and some nutraceuticals to help with her symptoms. And she asked me in one of our visits if I had heard about the Coimbra protocol, and I had not. So I did some internet sleuthing. There wasn't a lot of information online about it, except for random things in forums. But I did find a doctor in the States who did do the protocol. So I gave him a ring and got him on the phone, and he kind of told me what it was. And when he heard that I was a naturopathic physician, he said, "Oh my goodness, this would be perfect for you, because you already know about all of these nutrients, and you know way more than we do about vitamins, because we didn't really get that training in medical school. So I think that this could be right up your alley. You should go check it out." So with that encouragement, I found Dr. Coimbra's clinic info, and I called them, and finally, it took weeks to hear back. Finally got an email address. So I emailed Dr. Coimbra to see if I could come down for training, and I kept checking in every few weeks. And then finally one day randomly, I got an email back saying, "Yes, we can see you. Here are a few dates." They were in very very soon upon us. I had about 6 to 8 weeks to
How
prepare.
many doctors can they train at a time per week?
Um, well, when I was there, there was one other woman with me training, but I would assume maybe two other people would be able. When the training is basically shadowing him for the time you're there, and so there's only so much space in his office. There's two of us. At one point, there was another doctor that came to sit in on a couple of the visits, so he could probably train 4, 6 if he was really pushing it at once. Yeah. So I made a mad dash down to Brazil, and I was there for 2 weeks. And while there, I spent most of my time sitting in Dr. Coimbra's office as he saw all of his patients and put them on the protocol, helped them through the protocol. And in between patients, he would explain what he was doing and why. And I'd look at MRIs and look at different labs and ask all my questions. And it was a really amazing experience. He practices a lot like a naturopathic physician. He sits there and he takes time. I mean, he sometimes would be with a patient for like 2.5 hours before the next one was brought in, and just really explaining every single tiny detail of the protocol to them, which was really helpful for me in my learning. And while I was down there, that patient that had first alerted me to the protocol, I emailed her and said, "Hey, guess where I am? Come get on my books. Let's get you started." And then when I got back to Seattle, I just hit the ground running and haven't stopped since.
I see. What are some of your personal greatest experiences that you have witnessed doing the protocol? I would say maybe the most rewarding things that you've seen.
Oh, so some of the two main experiences that have really sat with me, that keep me going when I'm having a frustrating patient, or I'm overwhelmed, is this one particular person had lost vision out of their eye and had been gone for, I believe, over a year. So it wasn't just like, they were flared and we were waiting for it to go down. They had tried steroids, all of the things. Vision wasn't returning. And within 3 to 6 months of being on the protocol, the vision came back in their eye. I thought that was pretty amazing.
Wow.
And then I've had several patients that have come to see me, and their initial walk analysis, their gait analysis, where I have them walk up and down my hall and time them and see how well or not well they're walking. And then they come back 3 months later, or maybe at their 6-month follow-up, and they've gone from having to hold on to the walls to being able to just walk at a normal pace without assistance. Those are the two biggest things that have stood out for me in terms of symptom improvement. But the most rewarding, I think, is being able to offer people another alternative and seeing the pain in them decrease, or I guess hearing that the pain in them has decreased, that their energy has improved, that their cognition is improving. Those types of, and then they say, "Thank you so much. This has changed my life." It's that stuff that's the most rewarding, because people come to me often in a really desperate state, and
Yeah.
it can be quite, especially when I first started off, it was a bit intimidating. But then seeing how the protocol really helps and how grateful and thankful they are. And, really it's mostly for Dr. Coimbra. I'm grateful for him.
Oh, yeah.
That's the most rewarding.
It can be gut wrenching because people come to you and they're so bad. And you want to, I've watched videos where I watch doctors say, "You're going to get better." And I'm like, how can you say that? Typically that is the case, but not always.
Mhm.
And but you want to, I say all that to say, you want to be able to say to people, it's going to stop, then the nightmare is going to stop. And when I was going through this, I was told, 30 or 40 days, or 60 or 90, I don't remember, he said, you should start feeling this. And I was like, I wanted that. I hoped that, but I hadn't seen that, personally. And so I was a little I wasn't a little skeptical. I was a lot skeptical. And, but when you finally see it, oh my goodness, it's just incredible. It's miraculous. Dr. DeMoss said a few weeks ago, if he had not written it down and seen it with his own eyes, that if his best friend had told him, he wouldn't have believed it. And there's been a few cases like that for me that I've been just like blown away. You're so grateful, that there's something out there. Because when I started, I went on another page on Facebook. I was having problems. I was progressing. I put my problems out there, and you could have heard crickets in the background from the people responding back, because I was getting worse rather rapidly, and nobody was saying anything. So when I found the protocol, I wanted it to be true. I hoped that it was true, but I was like, you know what? This is just too good to be true. I mean, there's no way. And when it actually started happening to me, I thought, you know what? I got to tell everybody about this, because I was looking, I had a guy tell me, people say the stupidest things to you when you're sick. He said, yeah, my grandma had MS. And before she died, we'd tape her eyes open so she could see. I'm like, that's nice. That's very comforting. Thank you. And I was like, you know what? When I started getting better, I was like, there's probably some dad out there laying on his bed, wants to watch a little girl get married, and is like me. I was like, I won't be alive, in another 3 or 4. That's the way I felt. There I go talking about myself again. But you know what? It's personal with me.
Yeah.
When it's personal with you, you're going to end up talking about it. And that's why we do what we do. Well, let's get back to you. Like I said, I think a squirrel ran by. I'm the poster boy for ADD. So I want to focus on you. Explain the protocol at a little bit more in depth, if you can, for people if they've never heard about it.
Yeah, so for people that have never heard about the Coimbra protocol, what I tell them is that it is a high dose vitamin D therapy intended to suppress the white blood cells responsible for creating autoimmune disease. And it's not just vitamin D. There are 11 other nutrients that we prescribe alongside the vitamin D to help the body interact with that, what is essentially a hormone. Vitamin D is a hormone, not technically a vitamin. It does not come without some significant risk. Mainly hypercalcemia and osteoporosis also could also cause kidney stones, but we have very specific diet, hydration, and exercise requirements to keep one's body safe while on the protocol. And if followed, 99 times out of 100, there are no unwanted side effects if followed, and if you keep your regular follow-ups. I think that's a really important thing I've learned as I've continued to do this protocol, is I pretty much demand that all my patients follow up with me regularly so that I can make sure that we are keeping their body safe and checking lab work as we should.
I want to say this. Typically, we see no side effects if people follow what they're to do, drink the water and do their blood work. When I was starting with someone, she asked me if there's any side effects. And I told you, I'm not really good at comforting people and being sympathetic. And I said, well, I have this kind of thumb growth in the back of my back, and I have hair growing in strange places. But besides that, really, there's no side effects. And then I waited a couple minutes and I went back to her and I said, no, I've had none. And I've had absolutely no side effects from the protocol. That's not to say that they're not out there if you don't follow it. And maybe even if you do follow it, that's why you use a doctor. And that's why a protocol doctor is so important, because
Yeah.
they can stay on, they've seen it. And if they haven't seen it, they can research whatever you're going through. And it's very important to work with the protocol doctor.
I can tell you about, I would think maybe on average once a month I get a new patient that that comes to see me because they, they initially saw somebody and then they decided to do the rest of the protocol on their own and it didn't really work, and or they got really sick and they just want another opinion, and I'm able to look through the history of what they've done and say, this is why you need a protocol doctor, because here are the things that have been missed. Here's why you were getting ill. Here is why it didn't work the way you intended to have it work, because you don't have that knowledge behind the protocol, the understanding of human physiology to help you navigate those things. And I get why people want to do it on their own, especially people with chronic illness like MS, because they are so used to for years going to doctors and being dismissed, being told they're wrong when they're not wrong. I mean, I will often tell my patients with chronic illness, you know more about your illness than I do, but I know more about the human body than you do. And so together we can come up with the best way to get you healthy.
I couldn't agree more. I went to doctors for 15 years and kept telling them there's something wrong with me. And I'll never forget a emergency room physician laughing at me when I told him the left side of my face was numb, left side of my body, and he wouldn't run an MRI or do a spinal tap. And when I told him I had Bell's palsy, he started laughing at me. And I said, that's it, because he asked me, what do you think's wrong with you, Mr. Otwell? I'm like, well, you went to medical school for 8 years. Isn't that what you're supposed to tell me? I was guessing. I mean, the left side of my face was numb. Well, it ended up, that I had MS. And the day that I actually found out I had MS, I was happy, because I'd been telling them
what was going on.
Yeah, I'd been telling doctors for years, that something was wrong, and they're like, go over there and breathe into this bag. All right, moving right along here. Do you use MRIs?
I personally no, but because in most patients' insurances, they need all these prior authorizations if a PCP is going to order an MRI, typically. So I always refer to my patients or my out-of-state clients' neurologist for MRIs. I do like to have them done. I like to see how the neural tissue is or is not healing. I think that it's really good information to have. I will often counsel my I'll have a patient come in and say, well, my neurologist wants an MRI, but I don't think I need one. And if it's been more than like 2 years, I go, just get it done. Like, I get it. It's kind of a pain in the neck. You got to like lay in this machine and it's uncomfortable, but it's really, there's no other way we can actually look at your brain and spinal cord. So I prefer that they're done to the schedule of that person's neurologist.
People will like to argue that, you can't go by MRIs. It's a different angle and it's different this or that. I can only say that I've seen MRIs where there's a huge white lesion on the brain, and then a year later, it's gone. And I
know, and that is so, that's so, it's so encouraging, and it helps to keep a patient kind of doing what they're doing, even though they missed the pizza, right?
This one gal said to me, so I can't sprinkle cheese on my salad. I'm like, when you're worried about cheese, you're not that bad. I've often said you have to get worse in order to take this seriously, unfortunately. But if you're worried about sprinkling cheese, you're not bad. I can tell you that.
And Dr. Coimbra uses MRIs too, and that's a thing I'll always bring up. I try, because I've heard of some people being trained in the protocol and then kind of going off script and seeing what a disaster that can be. And I have actually helped to get those people back on track with the protocol.
Yes.
I try to
Yes.
follow as closely as possible to what Dr. Coimbra does. And for that reason, I don't discourage the use of MRIs because he orders them.
You know, the man has been doing this close to 20 years. He's seen a lot and experienced a lot. He's not God, he's not perfect, but he has seen a lot. And so, whatever he does and whatever he says, I typically, say, well, the guy's been doing it 20 years. There's not much that he hasn't seen. And, I think the guy's a genius anyway. What would you say to your fellow doctors? Or can you say to your fellow doctors? Because if I were to come and somebody were to say, you need to talk to my doctor, Dr. Tressa Pinkleton, what do you think you'd say?
What would I say?
Yeah.
What, like, about in what?
Well, let's just say
About what?
if they came to you about the Coimbra protocol, what do you think you'd say?
I would
can you
say that, no, I mean, I've had people ask me, what about this protocol? What do you think about it? And I've said, I think that if done properly, it can do wonders. It's not a cure-all, like some people like to think it is. It's not a cure-all. And you
Right.
have to be really vigilant and be there for your patients. And there have been a few colleagues of mine, I had this one colleague that wanted to know about sending her resident to go learn the protocol. And I said, I really think you need a little more training as a doctor before you get into the protocol and know a little bit more what you're doing, because when things go awry, they really go awry, and you have to be confident and not super green. And I've had other colleagues ask, well, what about me with the protocol? What do you think? And I say, I think it's great, but you have to know that you're going to spend more time with your patients than with those patients, that subset, than others, and just be aware of that. They're going to need a little more from you. But if those things are fine, then I think the protocol is a wonderful thing. Yeah, I think that's how I would answer that question.
Okay.
Mm-hmm.
Explain why you put together a supplement that has vitamin, or does it have vitamin? It has magnesium and other supplements.
Yeah, the CP
multivitamin. Yes. Why did you put that together? And maybe you could explain that a little bit.
Yeah. So like I said earlier, I try to follow exactly what Dr. Coimbra does. And when Brazil, Brazil has some pretty cool stuff when it comes to health. I treated this one Brazilian client once before I was a doctor. I did some body work, and she was telling me, oh, if you need an MRI, they're open 24/7. You go and you give them your prescription. It costs you like $20. It's not a big deal. Like really cool things. And so what Dr. Coimbra does is when he gets done with the visit, he gives them 2 prescriptions, and one is for the vitamin D, and the other one is for all of the 11 other nutrients. And the patients are directed to take those prescriptions to what's called a compounding pharmacy, which is basically a pharmacy that can make really specialized stuff. And so they get an oil with I think it's an oil with their vitamin D amount that they take a certain amount of, every day. And then the multivitamin component are all of those 11 nutrients: magnesium, riboflavin, B3, B5, B6, methylfolate, methylcobalamin, selenium, chromium, choline, and zinc, packaged into one capsule that they take 4 times per day. And it's brilliant. And people in Brazil can do that, from what I understand, very easily and affordably. So, I left Brazil, came here. We don't really have that here in the States. And so what I was having to do to get to exactly or close to what Dr. Coimbra was doing is they'd have their magnesium pill that they take 2 to 3-4 times per day. And then their riboflavin, they take 2 to 4 of those a day, and then they take an extra B complex. And then I was able to find them a little bit of extra methylfolate because the B complex didn't have enough. And then I found a zinc supplement they took a couple times a day, and then a selenium one they took twice a day, and a choline one they took 3 times a day. And like it's a lot, right? And they were
Right.
taking 30 pills a day or more, and the schedule was all crazy, and they got what I like to call pill fatigue. I see pill fatigue a lot in my in naturopathic medicine, and one of my favorite things to do as a naturopathic physician is to have a patient bring all of their supplements, and I will line them up on my desk and literally knock the ones I think they don't need down. Like, I love it when patients don't take handfuls of pills every day. So having to do this so they could get all those nutrients, and seeing them struggle with keeping up with the schedule really bothered me. So I said, you know what? If a patient wants to do that, that's cool. But for all of the other ones that don't, I'm going to make them a multivitamin. So I found a prescription that Dr. Coimbra shared with me when I was down there in Brazil. And I literally matched the nutrients up line by line. And I sent it to a multivitamin manufacturer. And I said, can you make this for me? And can you make it affordable? Because you can make it, but if my patients have to spend $100 a month on it, that's a moot point for me. I want it to be affordable and accessible. And they said, yeah, absolutely. And my partner, he's a designer, and I got him to design me a label for it, and we slapped it on there. And that is how the CP multivitamin was born.
I see. Yeah. I gotta say, when I started the protocol, and I've continued this one. I've taken your multivitamin, but I when I ran out, I've just taken the vitamin D, magnesium, and B2. I go back to the original protocol. That's what it was when I started. But it changed along the way. It's changed to include the other vitamins that you're incorporating in the supplement. If people want to get that supplement, how would they go about doing that?
So I have my website, drpinkleton.com. It's sold through that. It is separate from my clinic. So the clinic I am in right now, I'm an employee of. And if I was to sell it through the clinic, it would be much more expensive because my clinic director would mark it up a lot. So for that reason, I keep it separate from the clinic, and it is sold through my website. It's a one-woman show. So I tend to ship out once a week. Sometimes it takes me 10 days if I'm a very busy primary care physician, so it can take me a minute sometimes, but they always get shipped out. And so just my website, drpinkleton.com. There's a little button at the top. I think it says shop or store. You click on that, and I ship all over the world.
One other thing I want to touch on is that the Coimbra protocol does treat other things besides MS. Personally, you and I have witnessed somebody with myasthenia gravis get better, a young boy. And my father died with myasthenia gravis. And so I know what it can do to your body. And that was very rewarding for me. But what are some of the other diseases that you personally have treated?
Yeah, so psoriasis, and I've treated severe eczema, rheumatoid arthritis. I'm trying to think of some other ones.
What about Crohn's?
Oh, yes, thank you. Crohn's and UC. As a naturopathic physician, I will also, for people with gut issues, intestinal bowel disease, I will also kind of throw in my hat with some dietary stuff with them as well. I can't help it. I have to. And then I do see a lot of I don't know what this is. I've seen every single specialist. Nobody knows what it is, but we're pretty sure it's autoimmune. I do a lot of that. And I go, okay, let's give it a year on the protocol. If you don't get any better, we're going to pull you off because the risks won't outweigh the benefit at that point. But if you do get better, then great, and we'll just keep you on it.
What about Hashimoto's?
Yes. So I have had a couple people come my way with Hashimoto's, And I know how to treat that very well without the protocol. So I tend to say, let's try it this way first. Because again, the protocol doesn't come without risks and major lifestyle changes.
Right.
So typically, actually, every single time they've not ended up being put on the protocol because the other things that I do work so well. That being said, I do think the protocol could help. I have seen people come to me for the protocol with MS and also Hashimoto's, and over time they've had to alter their thyroid medication because their thyroid was getting better.
Now, if somebody wants to contact you about doing the Coimbra protocol or wants to just use your service, how would they go about doing it?
Yeah. So you can go to my website, drpinkleton.com, and in the contact, there's a little contact tab at the top, and there will be my clinic info. Really the best way to get a hold of me these days is to call the clinic and either schedule an appointment, or I also offer a 15-minute complimentary phone consult if you just want to chat and tell me, what a problem is that you have, and I can tell you how I might think I can help you or not and point you to a different direction. If scheduling for the protocol, I do recommend doing that 15-minute consult because it's just a way I can kind of explain how our clinic works without having to tag that on to the end of an hour and 15-minute appointment with me. And it's a service I really like to have. I like to get to know my prospective patients and clients if I can.
That's one thing I tell people all the time is that, you're going to sit with the physician at 30 minutes, 60 minutes. It's going to be longer than you've ever sat with a doctor in your life, probably. For
Yeah.
me, it was like an hour and a half first meeting. And so that's the thing different about the protocol is they learn everything about you. And I really like that. I really enjoyed it. And, people are like, well, I can't afford it. I can't afford it. And I'm like, listen, what's your health worth? And it's not that much. I mean, I would tell people to beg, borrow, steal, don't get caught. But I would tell them do whatever it takes because really it's inexpensive and it can change your life.
I try to keep my rates reasonable. Yeah. And I hear our healthcare and insurance system here is a bit of a racket. So I understand the frustration with the cost. For my patients that live in Washington State, I do accept insurance, so that can be helpful for them. But unfortunately, out of state insurances won't cover doctors unless it's an emergency situation.
Well, one other thing we should address before we get off here is because of the COVID, just because of technology, doctoring has changed. And I tell people all the time, I have never met a protocol doctor in person. And see, I grew up with my family is doctors and nurses and people in the medical field. And you always met a doctor face to face. And that's not the case anymore. Can you address that a little bit as far as from your perspective?
Yeah. So before the pandemic, when I first started, I was doing teleconsulting, and it's something I love. I mean, I've been able to help people literally on the other side of the globe as me, which is awesome and kind of exciting.
Yeah.
And it can be a little confusing. We have to think of time zone differences. But I mean, I'm not sure exactly what kind of answer you're looking for, but I think that telehealth and teleconsulting, and I use those terms, I say those two terms because in the States right now, the practice of medicine is done where the patient is at. So if I was being your doctor right now, I would be practicing in Missouri. You're in Missouri, right?
Yes. Or
Yes,
as my wife calls it, misery.
Missouri. But I don't have a license to practice in Missouri. I only have a license to practice in Washington. So for people out of state, I'm not their doctor, I'm their consultant. I still tell them all about the protocol. They get the exact same information, but instead of me diagnosing them and prescribing them medication. I'm giving them health recommendations, right? It's it's a little bit of a semantics issue, but it's necessary because of legality. That being said, it hasn't prevented me from helping people all over the country, as I said, all over the world, and um, I like to think, and I hope that in the future the laws of medicine will catch up with technology, because really that's just the problem, is that
Yes.
the laws have not caught up, and that more doctors will offer this option. Because of the pandemic, I switched most of my primary care practice over to telehealth, and it's really gone off without a hitch. I'll still bring people in for physical exam if needed, a rash, something in pain, that type of annual exams, that type of thing, of course, need to be done in person. But I don't know where it's like where you live, John, but Seattle traffic is, well, pre-pandemic was horrendous. And the idea that I can help a patient with something like anxiety or fatigue,
Yeah.
or even IBS, and have their follow-ups be telehealth, and they don't have to spend half an hour driving to see me from 2 miles away, is a really nice thought.
I lived in San Diego and I worked in LA for several years,
You
so
understand.
I understand traffic. Um, one other thing I want to touch on here before we get off is that, and I touched with Dr. DeMoss, and this is what I find 90% of what I help people with is just being there, talking to them. Um, it's stress. I don't know how stress triggers the MS and the symptoms. I know it does. But you need, as a Yara Wanderlust heard from Dr. Coimbra, you need to get it under control or you're never going to get any better. Well, um, that for some it takes time. And because we've lived our lives, just go, 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 go. 99% of MS sufferers are type A personalities and they go, 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 go. And I talk to some now who are relapsing, remitting, and they're working till 12 o'clock, still at 12 o'clock at midnight.
Yeah.
And I'm like, no wonder you're sick. You're just a stress case. So maybe you could address that some with the protocol or just health in general.
Yeah. So you're totally right. And what I tell patients is, one of the lifestyle changes is lowering your stress level. I always ask my patients and my clients, rate your stress level on a 1 to 10 scale, 1 being hardly any, no stress, 10 being unbearable stress. And if they answer above a 5 out of 10 routinely, I tell them, like, this protocol can help you in the sense where you won't get any worse. And we do consider that success. Like, yeah, it might not be ideal, but not getting any worse with a chronic illness like MS is success. But if you want to see the benefits of getting better, you've got to bring that stress level down. And the way I explain it is we have kind of 2 sides of the immune system. We have a fighting, killing, attacking side, and we have a healing and repairing side. And the attacking side is powered by the sympathetic nervous system, and the healing side is powered by this parasympathetic nervous system. Now, without getting too technical and sciencey, sympathetic nervous systems are fight, flight, kind of our stress response, and parasympathetic is our relaxing response. So if you're constantly a 6 out of 10 or above stress, you can't engage that healing side of the nervous of the immune system. You can't. And so we might be able to stop your immune system from continuing to attack your nervous system or your joints or your thyroid or your smaller large intestine, so on and so forth. But it's going to be really hard for that healing side of the immune system to come in and engage with the damage that's done in any significant way, because the little it can do, it's going to focus on things that could actually kill you, like an open wound or something like that. That's what it's going to focus on before it goes and tries to undo what its buddy did the other year, right? So I do a lot of counseling and stress reduction. I actually just yesterday prescribed somebody on the protocol a 2-week vacation without in-laws or
Wow.
children.
Wow. I'd like
2
that.
weeks.
I
I call
take
it a
that.
hard reset. So you need a hard reset because you're too stressed and
Yeah.
you're not going to get any better. And it's a hard truth to hear, but it's true. Sometimes I will prescribe herbs to help people relax their nervous system. Sometimes I will prescribe one of my favorite.
Yeah, I know herb in Seattle is legal.
Well, not that herb. I don't tend to
kidding.
prescribe that herb.
I'm just kidding. We don't suggest herbs.
Yeah, but
That's fine.
we call them nervine herbs. But I'll sometimes prescribe something called biofeedback therapy. You should check that out. It's a way of teaching your nervous system to calm down so that even if you live a busy lifestyle, you can remain relaxed in it. And that's such a powerful tool to have. I do a lot of work. Often I tell people to go see a counselor though, because a lot of times the chronic stress is rooted in, something that needs to be worked through in the psyche and in the heart. There's a reason why people work themselves, burn the candles at both ends and work 12 to 14 hours a day. There's a reason for that. And if we can't get to that reason, the lifestyle change will be difficult to implement.
I agree. Yeah. Well, Tressa, it's been great talking to you, Dr. Pinkleton, I should say. It's been great talking to you. We've talked for about an hour here. I could talk to you all day. I just love it. But we'll cut this off here. I'd like to do something with you in the future. If you have any questions, please submit them to Dr. Pinkleton, not me, because I don't know. You're doing a great job, and I think people are really getting better, and we don't overwork yourself.
I don't. I used to, but I don't anymore.
Sweetie.
Good.
Did I stop it?
I think you stopped it and restarted it.